There's a good chance you or someone you know is living with atrial fibrillation or AFib.
The American Heart Association says 5 million people currently live with the condition. Patients often describe AFib as feeling like their heart is flip-flopping or skipping beats, while others may have no symptoms and only discover they have it because of a smartwatch or medical exam. Cardiologists prescribe blood thinners to reduce the risk of blood clots and stroke in AFib patients. But the medication does come with a high risk of serious bleeding and bruising.
Reporter Jen Pachano shows us how an implanted device treats the condition.
At the Whatnot shop in Austinburg, co-owner Stacy Jocelyn does a lot of heavy lifting, moving furniture. But ever since her AFib diagnosis, she's been on blood thinners, and that's been a problem.
I couldn't tell you how many bruises I had. I mean, I would barely get tapped, and I would bruise. It was horrible. I mean, it looked like I'd been through a war some days, just because like I would touch a piece of furniture.
Her blood thinner also put her at risk for serious bleeding events, something her doctor wanted to help her avoid while still protecting her from a stroke. Enter the Watchman.
It basically works at the level of where those blood clots form.
Dr. Stephen Philby says atrial fibrillation, or AFib, represents sort of an electrical storm in the heart, and it can lead to blood clots in the upper chamber.
More than 90% of the time, they form in a little pouch called the left atrial appendage. And of course, if you form a clot in the heart is pumping blood, that blood clot can get trafficked or passed from the heart into the circulatory system, and most often it goes to the brain, and that's why AFib causes so many strokes.
Dr. Philby says that little pouch is like the appendix of your heart.
So what the Watchman device does is it blocks that pouch. It basically caps the mouth of the pouch and occludes it so that blood clots can then not come into the heart circulation and therefore be pumped to the body and cause a stroke.
AFib is the #1 cause of stroke in the U.S., but the Watchman is delivering freedom from the dangers of blood thinners with the same protection from stroke. It's minimally invasive surgery that's over in 30 minutes. Patients go home the same day. As for Stacy, the Watchman addresses her risk for stroke.
The main thing is it's going to stop any blood clots trying to get through. So that made me feel a lot better.
Doctors say only half of patients who are prescribed blood thinners actually take them because of various reasons, including cost, side effects, and not wanting to be on daily medication for the rest of their lives. Dr. Philby says those patients are the ones who are really at risk and should consider this procedure. In Cleveland, I'm Jen Pachano.